The views and opinions expressed on Analyze This are entirely those of the on-air participants and do not reflect those of the station's board, management, staff, or underwriters.
And we're back here on Analyze This, and we're joined in the studio by the Juan F. Louis Hospital CEO, Darlene Baptiste. Good morning. How are you?
Good morning, sir.
Hold on there. I got to put on that there for me. There you go. Go ahead now.
Good morning.
Yeah, man. Good to see you.
Same here. It's been a while.
Been a while, yeah.
Yes,
Yeah,
definitely.
20 years ago, man.
At least. I keep telling everyone, I'm back.
Yes, 20 years ago when I was in my first term as a senator, and you were the commissioner of health.
Correct.
Wow.
We sat across from each other.
Yeah.
Debated quite a bit.
Yeah, we had some fun.
But full circle, here we are again.
Yes. And one of your deputies is now a senator.
Can you believe it?
The Senator Hubert Fredericks
Yes.
was a deputy commissioner for the Department of Health.
And one of our chief administrators is also a senator.
Who that? Is it Ray Fonseca?
Exactly.
Wow, small world.
Yeah.
Yeah, man. So how you been, man?
Doing really well. I'm just really excited to be home and look forward to our dialogue and having some enriched conversation and getting some of that brain trust and some insights from you as well and the general public.
Where you been, man? Where you been?
We've been. Okay, let's start off.
Where you been for so long?
Well, when I was released, I love that. When I was softly released from government when the change administration, I was afforded the opportunity to go to Anguilla, the island of Anguilla, where I served as the CEO for the Health Authority of Anguilla. So I did that for a little over 2 years. Then I transitioned back into the government here for a year as a territorial administrator for training under the Division of Personnel. And then, of course, the BVI reached out to me to be the CEO, transitioning to their new hospital and help to recraft and retool their organization. So I was there for a little over 4 years.
No, pardon me. Excuse me. Before that, your background.
Oh.
You grew up where? All that good stuff.
All the good stuff. Okay, I need to do a disclaimer.
Go ahead.
So my body was born in St. Thomas, but my heart was born in St. Croix. Let's start off with setting that premise. Yes, I was born.
Proceed.
I was born and raised in St. Thomas.
Okay.
And so when I became Commissioner of Health, I just saw the need. The Charles Howard was going through some significant renovation. So we moved the office.
Is that public school or a Catholic school child? What are they?
We going that deep?
Yeah,
okay.
And they showed us what we do.
Anglican. I went to All Saints.
You to All Saints like myself. You're Episcopalian child.
Yes.
Yeah. That's
Born,
what I think.
Born and raised.
You know Kenny Benjamin?
Yeah, of course.
That's my best friend. That's my boy.
Get out of town.
Kenny and I went to the University of Miami together, man. That's why I met Kenny.
Okay,
that's what I'm telling you.
There we go.
We're Anglican children.
Yeah, I really enjoyed that experience. Being in the close-knit.
Yeah, correct.
And the fact of all of us are still connected.
Yeah,
thank God for WhatsApp.
Yeah.
We literally communicate every day.
Yeah. Morning, Kenny. Hope everything all right with you.
Good morning.
Yeah. Polybog.
Yeah.
Got a house right on top of the hill there where the Women's Coalition used to be.
Okay.
That's what Kenny them I live before they went
so
out.
you really connect.
No, that's my people. I mean, still out in Freedom Hoy.
Freedom Hoy, yes.
Yeah.
Over by the Hodges and the Davises and Freedom Hoy.
You know what time it is? Down in the flat before you go up on that. Before you go up on the hill.
You need to start scribing all of this down.
I like to actually commit it to brain so I can reach for it when I'm talking to you.
When you talk, okay.
You know what I'm saying? So okay. And from All Saints, where you went to school?
For All Saints, it was funny. I wanted to be a police officer.
For real?
Yeah, but I was graduating early and my father would not sign the consent.
Okay, good for him.
Oh, yeah, good for him.
Yeah, man,
So I made I made a conscious decision to go to some place that didn't offer me a scholarship to make my starting, do reverse psychology.
You had to pay back.
Yeah.
Okay.
It didn't work. He was like, okay, I'll pay for it. Not a problem.
Wow, I like that.
So I went to Howard University. I got my first degree there in 90, and I got my second degree in business in 92.
So you were there when the vice president was going there then? Kamala Harris?
We overlapped.
That's
Yeah,
an overlap, yeah.
she was in the law school.
Yeah.
Who would have thought?
Yeah, man.
So the atmosphere of women leadership was in the air even
You
then.
know what time it is.
There you
Yeah,
go.
you
There
know
you
what
go.
time it is.
So from there, I got recruited to Duke University to do my clinicals, which was really exciting.
For real?
In oncology, yeah.
Been in Durham?
Yeah, so I was there. I was at Duke University Medical Center doing my clinicals there
Wow.
for a little over 4 years.
Well, that's awesome, man.
Yes, I
Cameron
started.
crazies.
Well, the riff, the tension,
Chapel Hill here.
Exactly.
Duke here. And they got NC State here.
Like right that fine line.
yeah,
So,
that,
but I had
it's a research triangle.
I had the privilege of doing my graduate certificate in epidemiology at University of North Carolina in Chapel Hill, literally
okay.
15 minutes away from Duke.
So
So I
you-
had 1 foot
Carolina Blue and Duke Blue
and
wow.
the blue
Tar Heels, Blue
Tar
Devils.
Heels and the
all
Blue
that stuff.
Devils. Yeah. So
Yeah.
I had the 1 foot in. So whoever was winning, I kind of was like, oh,
I know
I'm,
them, I know.
I'm with them. And I'm
like
with them.
that, I like
But
that.
they were the leading entity for oncology. They were doing some really innovative things
UNC?
at the time. Duke.
Okay.
Duke. So they were the ones who wrote the book. So actually having my clinical rotation there was really eye-opening to the innovations there that are there. I mean, we literally have people flying from all over the world to be treated from some of the world-renowned specialists.
So you
in this.
officially became a doctor when?
So no, I'm not a physician, MD. I'm finishing my classwork. I did my project. I'm about to go to do my defense. I hate to say when, just in case, but in August, I'm supposed to be starting my process to defend my dissertation. Women in leadership,
Yeah,
and I'm
man.
using a faith-based approach in the comparable measures of discrimination among women, using a lot of the biblical context about women being less than or not recognized for senior leadership and the contribution they've done in the Eastern speaking Caribbean.
Okay.
So that's my topical
Wow,
area.
That's awesome. How long are gonna last? Hopefully not too long or
Not too long.
yeah.
I shouldn't say a little distracted now, but my priorities have changed since coming back home for the last 2 months. JFL has really been my focus. So I was supposed to do the defense in January. I moved it to March. I moved it to May, and now I move it to August.
Well,
I really want to focus on what's before me right now.
that's good to hear. Now, coming into the conversation, and having been in the arena, just looking at the data and all that stuff, is it all about uncompensated care and a structure that will always have us at an annual deficit?
That's what's one of the major contributors. The fact that we haven't kept pace with economics. Healthcare economics and healthcare financing has shifted quite a bit in reference to the outlayers. We have been, our allotment, while it has been appreciated, it hasn't kept up with the expenses and the financing needed to sustain and take us to the next level.
Yeah, but the uncompensated care thing was when you've been in high school. I mean, been going on for years. I mean, it isn't something that is new. We've been dealing with this, So, in fairness to you, I mean, are we subjecting CEOs to a situation where, they're more often than not going to fail? I just want to have a candid conversation with you in that regard. What can we do so that we could have successful CEOs, sound healthcare, and all that good stuff? Don't we have to fix the structure first before we keep talking about, well, we need this amount of money and all that?
Well, the thing is I think part of it is the fact of allowing the CEO, I mean, not just because I'm in this particular seat. In the last couple of months, I have not been able to really be the CEO, which is the visionary strategy to take us to the next level.
But a CFO.
Yes, I mean,
For the most part, dealing with CFO needs and priorities.
Diving into the economics. Again, you mentioned the uncompensated care. The thing is, for us, what we have seen, the trajectory of it is increasing from $25,000 up to projected, it could be upwards of $50 million. Million dollars. Yes, $1 million, while our allotment has remained constant. So by virtue of math, if we use the English
Vernacular,
let's do maths
Yeah.
with plural with the S. It's trying to strike that balance. It's really been a challenge. But I do made the statement, the fact of, as I've seen that we have not been good stewards of what's given to us as well.
Correct.
So that's compounded
It's a
the
management
manage.
thing there.
Yes.
Yeah.
So if they're looking at the levels of productivity, we haven't been fully functional to the highest level. Some of the services that we have provided have not been at the optimum level. And of course, we talked a little bit about it that folks really don't want to hear is like right sizing the organization. And what does that mean? We've gone from JFL Main into JFL North, carrying over, the same number and the workflow. That's one of my major pieces. In the last couple of weeks, I've done a performance review on pretty much about 90% of the organization. So that performance review is looking at unit directors, the departmental heads, coming before the executive and other key members, and doing their SWOT analysis. Let's look at really what your true purpose is. Your staffing model aligned? Is capital needs, and look at some of your critical areas that we need to address. And what we're finding is the fact that everyone is not functioning at that high level or that threshold, and the fact of there are certain systems that are out there that we can automate. So in case of having 4 or 5 people, you could actually have one and a half, because you want to have some level of redundancy for business continuity. And how do we automate some of those systems to make it streamlined? It's not about working hard, it's about working smart. And I think that's part of the vision and strategy that I would like to get to. But in the meantime, I still look at the stability right now. There are genuine concerns from the community. There are genuine concerns from the physicians. And we're not hiding behind it. It's a fact. We have to fix it. And that's some of the dialogue that we need to have to move beyond just the talk and the rhetoric. Let's go into action. These are the tangible things that need to take place.
What was it about your window as Commissioner of Health that has assisted you in processing what you're dealing with now?
One thing that I do look at is the fact of having been in our culture, even though I'm from St. Thomas, I still assimilate myself to the Crucian culture. The thing is, we're really passionate. I consider myself the we because I have a Crucian. I have a little, well, I shouldn't say little. I have a maturing young lady who's a Crucian. And the thing is, the fact of Crucians really love hard. They're very strong and passionate. So if that is honed into educating and bringing them along in the message, we could actually shift the position of JFL and get us to the next level. And that's one thing I learned at the Commissioner of Health. I have to give a shout out to the EMTs. It's nice to see Chief Brian in that position, and also my exchange with Greenwich. They taught me a lot by virtue of Jackie. Yeah. They taught me a lot from then, and that I take throughout my entire career. It's that rah against me and you. No, if we joined forces, we could make great things happen. They were having some major challenges with EMT because it was under the Department of Health. The ambulances were in disarray. The staffing wasn't happy with this disgruntled, and they actually took action. So instead of doing the back and forth, I decided to join the next class. So I went through the EMT class.
Okay. That's what I like hearing that. I never do that. That's awesome.
It wasn't easy, and I'm sure I make joke of it. I said they were extra hard on me.
It shows leaders willing to do, the non-executive, work, or
right.
It's not just about profile that comes with the gig. So that's a good move.
Yeah,
and that would be for anybody. For those who didn't necessarily come through the ranks.
Right.
Yeah.
So that taught me, that was very humbling, one, because I couldn't pull the Commissioner of Health card. I was just a student in the class. I had to take the test. I had to go through everything for that 6 months. I had to sleep.
While you were commissioner?
Yes.
Wow.
I had to sleep in the bunks. After experiencing that, now I was like, oh my gosh, this is the conditions we put them in. So having that live experience right in the ambulance, hitting the road conditions weren't optimal, and riding in the back of that ambulance wasn't easy. So actually living their experiences, being educated and seeing their position of how they view healthcare, kind of sensitized me to the fact of we need to give them the attention.
Did you receive any pushback from those who believe that our executive, our cabinet members ain't supposed to be doing them type of trivial or non-executive thing?
I honestly I didn't. Miss Malloy was the chief of staff during the Turnbull administration, and she was really supportive.
Okay, that's good. I spoke with her last week for the first
You
time.
did,
Yeah,
yeah.
sure.
She was
Nice
extremely.
conversation.
I mean, the fact of I still up to this point consider.
You're a relatively young
Harper
commissioner.
Yes, I was
in that administration.
I was 33, the first
Yeah.
female non-physician in that particular. So I think that a lot of eyes were upon me, and I think I went above and beyond to prove the fact of just give us an opportunity. We may not have the extensive experience and training, but the thing is, what, we have heart. And if you put that and you're being genuine with the staff, I made it a point to walk around as often as I could, started to learn their names and started to connect and be relational with them. So that's one thing I really want to take to be. I'm not just here, the same thing that you said, to showboat and, pad my resume. Been there, done that. That's not about it. I'm here to effectuate change and make a difference.
Now, since you mentioned that situation, I had a conversation with Dr. Chabot some years ago, and he was explaining to me how government was structured back in the 70s. That's 2-3 generations ago, but here's what he said. He said the way the government was set up, the assistant commissioner, I remember back then we didn't have the separation with health and hospitals, right? The hospital was a part of the Department of Health. The assistant commissioner was a federally funded position to protect the politics from impacting healthcare, right? Now, clearly we're in a different world now and all that stuff. But it's protectionist structures like that worked. You know what I'm saying? That do we need to revisit how we have our healthcare set up here in the Virgin Islands? Maybe is it a structural thing, or is it just if everybody is focused on managing and everybody's on the same page, we're going to be okay?
I would concur with the latter. It's not the fact of the oversight so much, because the thing is, the Department of Health has the regulatory piece, because there are, the education and monitoring and the enforcement arm of the health sector. So that's part of their role. Our part, whether it's SRMC or JFL, we're the executors of the provision of healthcare. A lot of it is just for us to get to a stabling point, and then from there we could actually start building the pillars, whether it's looking at optimum workflows, looking at revenue cycle, the fact of build in revenue activity and accountability and productivity. And then of course, like myself here with, I do have one team member with me.
Morning.
Just looking at the transparency, portion.
We're going to take a break. We're talking with Ms. Darlene Baptiste. She is the CEO at the JFL, the Juan F. Louis Hospital here on St. Croix. We got her here for another 40 minutes. So when we come back the next segment, you're going to talk dollars. Get up out of the way.
Okay. We'll talk dollars.
And
cents.
Of course, without a doubt. And that's SENSE.
Yeah.
Okay?
Okay.
We'll take a break. Be back right after this. And we're back here, analyze this, and we've got the JFL CEO, Ms. Darlene Baptiste, here in the studio. We were talking about Department of Health, because she was the commissioner of the Department of Health way back in the day. Get away your age, me, you know what I mean? You know what I'm saying? By the way, the Department of Health is actually one of the sponsors of Black Maternal Health Week, taking place here in the Virgin Islands. It starts today. It runs to next Thursday, and we recognize all the people who committed to that community baby shower taking place tomorrow. Right? So, Department of Health, the Temple Works Wellness and Therapeutics partners in health communities, VI, Neighborhood Pharmacy, Fresh Juice Bar, STEM South LLC, Carlos Furniture, HKT Energy Consulting Group, Rittenhouse Consulting, 11 Construction, Concrete Masters, VI, GMAX Service Station, CGVI, Zephyr Enterprises, Genesis Electric, Best Home, Paradise Fruit, and the Market, St. Croix. So thanks for stepping up, because a healthy society is what we're about, and 22 expectant moms are going to be the beneficiary of your kindness tomorrow. So, since we're talking healthcare, Madam CEO, got to talk dollars, man, because healthcare comes at a cost. Good morning once again.
Good morning, and thank you so much for having us.
Who's your
Well, I
staff
love
member?
to have this wonderful JFL employee introduce herself, our PIO.
Okay. Good morning.
Good morning. I'm
JFL, yes.
Yeah. Turn on the microphone now, Dan. Yeah, go ahead.
Good morning. I'm Mia John, JFL Public Information Officer, and I'm happy to be here.
Okay, good. Glad to have you here.
Thank you.
It's all good. So, let me break this down in lay people language for the audience. If you got all the dollars you needed for a fiscal year to run JFL, what would that number be?
88 million,
The government provides how much?
30.25.
Revenues are at what number?
It's estimated somewhere between 32 and 33 million dollars.
So you're at and how much, when I mention government, that include federal as well, or?
No, for us it's a little different because through our foundation, our chief of staff, as well as some of our local partners and national partners, have applied for federal grants.
Mm-hmm.
So we have, I think we've received 4 so far in reference to federal grants that will augment either services or support services for JFL.
So 88 is the minimum dollar requirement if you were to.
Optimum, but there's a
not-
difference between the minimum.
No, hold on a second. The reason why I use minimum is that the original question was if you had the amount of money you needed to run the hospital. You said that number was $88 million.
That was projected last year.
Projected last year. And so let me use optimum. Keep you comfortable. Right? I got obligation to do that.
Thank you.
30 million from appropriation from the government. Revenues at
Somewhere between 32 to 33.
32 to 33. Right? Let me use the big number. Let me use 33. And you have other financial sources as well?
Yes, we do have the federal grants.
Federal grants.
Maybe 2 to 3.
2 to 3. Okay, let me use 3. All right, so we had 66. So that's a $22 million shortfall. That's a stunning number, by the way. That's 25% of the $88 million. Wow.
Well, I mean, the fact of a lot of times we just blanketly defined what uncompensated care is. We do have the border issue, and those are persons, and some of our borders families have means to support, but for whatever reason, it doesn't occur.
Is your situation?
It's more costly for us to care for them in the hospital.
Is your situation unique to St. Croix, or is this a territorial?
It's territorial. Our sister facility, my counterpart, Attorney Commission, is climbing that same hill as well.
So it's a territorial issue.
With the borders, it is.
Wow. Can it be fixed? Let's just be honest here.
Yes. The senators, I came on the 5th of February and I had my first appearance in the legislature what, 2 weeks later? Yeah, about 2 weeks later.
That's in front of the
This health hospital and
Senator Fonseca's committee.
correct.
Uh-huh.
So we were addressing that same issue, the fact of some of our borders that we had at Juan are placed at in Puerto Rico at our expense, but also the fact of the capacity within human services. I really feel for the commissioner. She's really trying hard to address what the issue at Herbert Grigg. But when I went and I toured the facility, they are working at the highest level they can with what they have. So the fact of these wait lists in the community, we have the wait list for persons being held and cared for at the hospital. But again, the economics have to flow over to Herbert Greg to ensure that she can increase her capacity. She may have the space, but the thing is the operational pieces and the finances need to be there for her to take on this challenge that's before her.
Now, you're working at a 25% deficit using $88 million as the denominator. And you're doing this while we're still in a recovery?
Still in recovery.
That compounds your situation, or does it help it because we're actually putting new infrastructure in place that could assist in reducing costs? Or is the $88 million outside of infrastructural needs?
No, that's total operational. Total operational for Juan Louis, and that's all service lines being able to ensure access.
Is there anything that we're going to do infrastructurally that could reduce that $88 million number? To your knowledge?
Right now, again, the same thing, the visionary and strategy. There are things that I really want to do. We have to test the market a little bit. There is some automated, with the fact of technology and AI. There's some innovative ideas that, have worked in other areas that we like to pilot here as well. So again, without divulging too much, I think there are a plethora of opportunities, but we just need to get to the stabilizing factor. For the patients come to see the doctors. If the doctors aren't readily available or provided the instrumentation and the diagnostic testing and everything that they need to provide the care, then we're not in a very healthy position or condition as an organization.
Your relationship with the physicians, with support staff, how's that working out? Because you just reached, you're a new CEO, new executive. You got your style. Clearly there's a feeling out window and all that stuff. Talk a little bit about that.
I think my learning curve, because I'm from here and been here in the healthcare arena for a while, kind of lends itself to me to be a little more sensitized to our providers. But again, not only the providers, our community and our staff, they're just tired. They have been in survival mode for so many years.
This is more worn down is what you're talking about?
Yeah. It's really, really difficult. I mean, it really burdens me to see the fact of, especially our team going out, doing the best they can, and still not being fully respected as professionals. I feel as leadership that I have failed them, even though yes, I'm new, but the thing is I've taken on the responsibility to be the head of the organization. So I've taken on that burden. We haven't given them the tools to be successful. We haven't given them the support to be successful. And the same thing with the physicians. There's truth interwoven into the letter, but the thing is, there's some other things in the background that we're really trying to do to correct it in real time.
Now, our situation here, I don't mean to jump in here, but my father was a doctor, so I'm a little aware of what's going on and other stuff. Our situation here is the doctors do their wrongs at the hospital in the morning, and then they get their practice and all that stuff. Unlike some hospitals where you got full-time doctors and all that stuff. Break that down so the public will understand what you're dealing with from a structural situation and management and all that.
Well, a lot of it comes back to the compensation model that was used to augment, because the salaries were so low. They were allowed to have that flexibility to have outside resources avail to them. But at the same token, there are still some inherent things within our organization that we really need to address. There are mid-levels that can be introduced. I mean, that's one thing. I'm really proud of the experiences I've had on the mainland. The fact of everything I know for sure sure would not work here. I'm not bringing, but there's some things that we can actually pilot and introduce to help augment care. So the mid-levels, raising their ceiling in reference to their offerings will actually help build the system.
Break down mid-levels.
Mid-levels, those are our nurse practitioners and our physician assistants. One thing that I would really like to introduce especially is I'm looking at our spreadsheet in reference to the services that are provided from local and from outside. What areas are we looking at with the highest costs? So those will actually yield us a savings if we bring in persons. So I've been actively recruiting. One, I'm looking for persons who have an Eastern Caribbean experience or the fact that they were born and raised within Eastern Caribbean. That helps with the cultural centralization. Then we look at the skill set. We're inviting them to come down, do locums for 2 weeks, go take a week off and then come back. We're going to do like a working interview to see if they're a right fit for us and if we are a right fit for them. Everyone can't work in this system.
That's right.
You can't.
It is what it is. Yeah.
Yeah. So again, this will give us an opportunity to quote unquote test test the fit, because we've had persons come down, they last a week or two and they say, no, this is not for me. And then at the back end, we have to produce and provide the resources to make our physicians be successful. So that's inclusive of, can we go back to the dollar and cents? Our revenue management cycle. That's really one thing that I have really dove into in the last couple of weeks.
But by looking at these numbers here, on a quarterly basis, you running a $5-6 million deficit, and you got bills that you need to pay three times a quarter. You follow what I'm saying? That's hard because you got to be selective. You got to prioritize. You don't want this person to be, feel disenfranchised, this entity, and everything is need with respect to healthcare.
Yeah, it's striking the balance. Like the fact of every 2 weeks we have to position ourselves for payroll. We have to compensate the staff.
What's the staff number now?
The staff number is at 523.
For Juan Louis. 523 employees. That's a big number.
That is correct.
Wow. Similar in St. Thomas? To your knowledge?
No, it's a little higher in St. Thomas.
Okay.
But for us, folks need to one thing, because we always been using the base of the 2,080 hours for the year, but we are 24-hour facility,
Correct.
7 days a week, holidays. So that base number that we're using is incorrect in our calculations. So we need to interpolate. Like right now, I'm so grateful that some of our business office staff, our coding, billing staff, revenue staff, they're actually working Easter weekend. They're splitting the weekend off. So some are working Friday. Everybody's taking off. I mean, some are working Thursday. Everybody's taking off Friday, and it's always Saturday.
And Monday.
Yeah. So and of course, then we have like quarterly infusion where everybody comes in and we provide overtime on a split payroll cycle. So the Saturdays in the previous cycle and the Sundays in the next cycle.
Okay.
So we could augment.
Wow.
Getting the bills out the door. It's really a challenge because we have persons coming in and out of our system to manage the charting. We're half paper, half electronic. Going fully electronic, that's part of our significant relief because we could turn around our claims even quicker. We're really doing some strong
and unpaid billing, that's a part of that deal.
Part of it, of which we are addressing. So
because collections is what it's all about.
Clean claims first time around. So I'm looking at our denial rate literally every day. I'm monitoring every month because I do that report out. Our team does that report out to the board. But I'm looking at that denial rate every day. What is the leading CPT codes for denial? What are our services for denial? How can we strengthen those areas in reference to, again, our thing is clean claims the first time around. My plan is to make sure we have a cash flow at least every 3 days from those. We've gone back 90 plus days for all the denials, clean that up and get those resubmitted. Our cost reporting for Medicare, we've submitted that since I've been in office, and look at those submission of claims from Medicare.
Does CMS still exist?
Yes, it does. It's real.
You know what I'm saying? Because we know the administration know that, for whatever reasons they've been questioning how healthcare has been functioning for whatever window they want to use, but we're going through a transitional window from an administrative standpoint on the federal side. So what's our relationship with CMS?
CMS, we're about to enter our window for survey.
Okay.
So the team leading with our COO, Ms. Filbert, has done a heavy lift in reference to creating our plan of action. So every other day we meet and talk about all those deliverables to be put in a position for when they come. The window opens next month. So between there and whenever they plan to come for us to be ready.
You eternally optimistic about the future of Juan Louis Hospital?
Yes, almost definitely.
Given all these challenges, I mean, part of being a good CEO is being realistic. I'm saying part of being a good executive, is being realistic. The issues that we're dealing with, there are some, things that we deal with that are insurmountable that you're gonna have to actually figure out how, to not have them anymore, because that's what that's the decision making aspect of being a leader comes with. Certain things aren't working, certain things are working. Let's try to enhance what's working. Let's try to minimize what is taking away, because it's like the human body, right? If the right leg is forcing the left leg to do too much work, the left leg's going to go out eventually. Talk a little bit about that management reality aspect that you got to deal with.
The reality, I guess maybe my faith has allowed me to have this perpetual hope. We are from the Virgin Islands. We've been resilient. We have been commanding in our fields, respectively, literally all over the world. I do not feel is insurmountable. It's going to be a lot of work. I'm not negating the work that's needed, but if we hold it together, come together, the results will be phenomenal. It's not going to be today for today or even today for tomorrow. It's going to take a while. One of my previous bosses always equated the healthcare system to this very large, monumental cruise ship. You don't make one turn and the whole ship turns. Mm-hmm. It's those incremental turns that can actually make you go in the right direction. So that's my visual when I see JFL, and the fact of us being the only hospital. It's not really a
community
bad thing.
And a community hospital.
Yes.
We'll take a break. Come back. We got Ms. Darlene Baptiste and her PIO here in the studio. We'll be back right after this. And we're back here on Analyze This. Fortunate to have with me former Commissioner of Health, now the Chief Executive Officer at the Juan Hospital here on St. Croix, Ms. Darlene Baptiste. Good morning, Madam CEO.
Good morning,
Glad to have
former
you here.
Senator. Always great to see you.
Yeah, feelings mutual, without doubt. And Madam PIO, how are you?
I'm great. How are you?
Turn on the microphone now, Danny. There you go. Say it again.
I'm great. How are you?
Introduce yourself again.
Ania John, Public Information Officer at Governor Juan Hospital and Medical Center.
What's it like being the disseminator of information on behalf of the Juan Hospital?
I love it. It's a challenge every day, of course.
You want to we?
Yes, I am.
Graduated from
Born and raised, graduated from St. Croix Educational Complex in 2015.
Barracuda?
Yes, I am. I went to college in Pennsylvania at Seton Hill University.
Which one?
Seton Hill.
Seton Hill.
Not
Okay.
Seton Hall. Seton Hill.
I know Seton Hall in Jersey.
Yes.
Yeah.
I went to Greensburg, Pennsylvania, got my bachelor's degree in business administration with a concentration in biology and finance. And then I went on directly to get my master's in healthcare administration.
Same school?
Yes.
Okay.
And then I came back home. I worked at the Department of Health. I was the executive assistant to Commissioner Encarnacion.
Mm-hmm.
Then I transitioned over to JFL, and I've been there for, this year will make 5 years. And started out as change manager and then transitioned to...
So wait. I'm doing the math in my head.
Yes.
You knock out undergrad and masters in 5 years?
I would say maybe 5.5, 6.
5.5, okay.
Yes. So
Okay.
I graduated with my bachelor's in 2019 and then graduated with my master's in 2021.
Mm-hmm.
Yes.
How did COVID impact your studies?
Well, my master's was strictly online, so I'd already moved back home. So I was working at Department of Health while pursuing my master's.
That's
yes.
the overlap. That's the math part.
Yes.
Yeah,
So I was actually here doing it online, so it didn't have that much of an effect.
That experience at Department of Health has helped you with transitioning to JFL?
Yes, it actually did. I am actually fortunate. I actually met Commissioner Encarnacion doing my internship my senior year when she was at Acute Alternative Urgent Care, right next to the hospital. And so when I came back home, she afforded me the opportunity, and working under her, she was a great mentor. She actually held me really close to her side. I was pretty young, new to the field. So I was able to learn a lot. I was actually in really big rooms, being able to take in all the information. And then I knew that I wanted to be more on the acute sort of healthcare side, not really public health. And I made that transition over to JFL.
That's awesome.
Yes.
Glad to have you here.
Thank you.
So, Madam CEO,
Yes.
when you were the Commissioner of Health, what a fella name from St. Vincent, he was out of Brooklyn, was this CEO for Juan Louis Hospital at the time?
Gregory Calise?
Calise.
Yes.
And he had a long list of deputies. Kendall Griffith.
Chief Medical Officer.
Miss Peterson Plaskett.
Yes.
Darius.
Nursing officer.
Nursing officer. My good friend was her. Gregory Davila. Greg Davila was part of public information. Gregorio Davila, he was a part of that. All of them used to come in the legislature, sharp as ever, looking good. Right? I used to tease them and say, I remind me of when I was watching Clint Eastwood in Pale Rider and Stockton come with all the deputies and Clint Eastwood take all of them out. I don't want to have to get taken out.
Back up to the backup.
Right. Who are your deputies that you could that you're relying on? Not you could, that you're relying on to help carry out your mandate and the mandate for sound healthcare here on St. Croix through the Juan F. Louis Hospital?
So let's start with our Chief Medical Officer, Dr. Mavis Matthew. She's the interim Chief Medical Officer, so there's been a search.
Also a former Commissioner of Health. Yeah?
Also, yes.
Wow.
She was
That's
my
awesome.
predecessor.
Yeah, okay.
For the Department of Health. So in her capacity, while she's currently out, our acting CMO is Dr. Regine Flipping.
Okay.
So she is in that capacity. Then we go over Nurse Doris Plastic is our Chief Nursing Officer. So she has returned.
Okay, that's good.
Returned back home, which is really great. Then we have our Chief Operating Officer, Miss Hazel Felbert.
So we got three Oh no,
She was commissioner of health as well.
Yeah, and
Yes.
she was also she wanted to CEO of one of the
She was the interim and acting CEO for duration.
That's good. That's good.
Yes,
So
again,
we
the
got
brain
institutional
trust.
knowledge.
So you do, yes, exactly. So you do have that. Then the same thing with our chief operating officer, Miss Hazel Filbert. She has tendered her resignation. She should be leaving us next month. And she's one of those who have moved up through the ranking, coming in at the director level and moved up to CEO. And she was actually the interim CEO prior to me taking on the role.
Okay.
So again, the capacity is there. We have our chief of staff, James Rollins. We call him Jay. Coming from the private sector, and he's been really great in reference to us seeking and obtaining these federal grants from an operational perspective. And of course, you can't move without your executive assistant, Ms. Diafra Payne. Yes, she's my executive assistant. Okay. We call her the police.
Okay.
So she keeps order amongst us all. So that's the JFL team.
Mm-hmm. And that group, that satisfies your needs for now, or you're looking at other areas that you might need to expand into?
Well, I mean, it's
who's responsible for the recovery?
Key to the recovery is our chief operating officer. So with Miss Filbert transitioning out, that's one area that I really need to focus, especially with the CMS visit looming, and the areas from environmental of care, which is we're looking for a senior facilities director. Plug. That's one area that we really need to really focus on, and we also need to address our quality measures to make sure we maintain. So when they come, we have everything in order. So that's one area that I'm really, really focused on. The stability from all the other areas, I think we really have the directors and unit managers have a great command of their areas. Again, I think the hard part is the right sizing. What does it look like? As persons exit for retirement, we're not automatically backfilling those positions. We're actually looking at the functionality and see where we could do some job sharing or bring persons in who are already certified in those areas so they could actually have more functionality for those units. So again, we're doing our part to ensure that we regularize our area first of all, and most importantly, make sure we're functioning at the highest level possible.
The GRS is always a concern. There was an article with respect to Schneider Regional Medical Center not meeting their obligations. What's the deal with Juan Hospital?
We've been fortunate enough. I think there was an infusion a couple of years ago, and those funds were earmarked and given to GRS. We've realized there's been some missing issues, so I've reached out to GRS directly to Director Dawson to sit down with him and to ensure that the documentation that we had a team, I think of 3 persons over the years, of which still were with Wang Louis, who did the initial review. So we're gonna go ahead and try to regulate that because we've identified some challenges, but for the most part, that's not an issue for us.
That's good to hear.
With Wang Louis.
Now the recovery. Let me get back to that. That's a big issue with that Brian Roach administration. Are we going to see the JFL, the new JFL, a reality in St. Croix?
That is my hope. That was one of the reasons, again, based on my prior experience in transitioning into a new facility with the construction of Charles Howard, and the same thing in the BVIs.
Is this a transitional facility we have there now that you're working with now?
That module is supposed to be temporary, but the temporary is about to hit.
Historically, our temporary will end up being permanent, which is a bad thing for us here in the Virgin Islands. We can't continue to do that. You can be expected to manage a true healthcare facility with what going on up there. You're doing it. You know what I mean? You're making do. That's what we, this effective poorhouse label that we got 90 years ago from President Hoover has become way too much the exception and the norm. I want to make sure I speak properly with you, parochial school children sitting in front of me. You know what I'm saying? So,
but Senator,
we need that facility, man.
All people, yes.
How much it cost to build up? If you given our needs, you've done your due diligence. given our needs, if you were to start from scratch, what would the dollar figure be to satisfy our needs to construct the appropriate facility for the community hospital? Because that's the next thing we need to talk about, right? This ain't a private hospital and all that. It's a community hospital. We only got one. So from that standpoint,
I can't give you a true number because the thing is, I'm not fully apprised of all the services that are going to roll out.
not yet, you mean?
Not yet.
Oh, okay.
The thing is, I have like 4 focal areas, but I haven't had the opportunity to sit with the physicians and get their input in reference to how do we prioritize those areas. My decision is not only based on access, but also on economics. But the thing is that linchpin is all physicians having the ability to voice and make their concerns known, specifically in what direction we should go from a clinical perspective.
My two partner them for the table talk, Rocky Labor and Doc School said to tell you, they said to tell you good morning.
Good
listening.
morning.
And they said good morning to me.
Oh my gosh, it'd be wonderful to see them at some point.
Yeah, and they said Amos, your
Yes.
partner. They said that's Amos' cousin, and I said yeah, but I know about that. That's my guy too. You know what I'm saying?
Yes,
we
a
spoke-
former CEO for Schneider
yeah,
Regional.
yeah, and we spoke
Yes.
yesterday as well. So couple minutes left. 'Cause you know when the conversation good, it'll fly fast.
That means you invite us back. I'm looking.
Yeah, well, my job is to just get information out, let the public determine based on what they hear, and how to break down what they heard. Let's get back to the physicians, because the human dynamic, you can't ignore it. We might all be professionals and all that stuff, but we're still human beings.
Yes.
That relationship, there was a time when we didn't have the separation with health and our hospitals, they were all folded into one, that you had to be a doctor to be the commissioner. You check what I'm saying? Now we got managers and folks in the medical field who are running facilities. All right. Talk about that human relationship thing there, that massaging or the finesse that's required to keep both sides comfortable. You're on the management side and you got the physicians.
It's called the art of framework.
Art of framework.
That's the terminology that's used in reference to how do you merit all these professionals?
It's a Duke thing or a UNC thing? Or a Howard thing?
It's a health thing.
Okay, good.
A lot of it is because going back to, again, you go to the fundamentals of the theoretical framework, the fact that the physicians, the patients come to see the doctor. They don't come to see either one of us. We're just a support cast.
So you're in a providing role. You're the master provider.
So I consider myself, if you're looking at a matrix, the fact that I'm the maestro, kind of letting all the pieces just like flow and intertwine into making this melodious sound. In our case, is the provision of quality health care. So the key role of the physicians cannot be ignored, and bringing them around the table to have input in how do we come to a resolution, not only for them, because yes, it's taking an emotional toll on them, because they're at the front line, they're providing the care. We can't do it without them, but at the same token, we need to make things possible for them. Again, not only the facility. One of my major pieces initiative is to do a line item budget for the organization instead of having like this operational fund. You look at our revenue generating areas, prioritize those, rebuilding our relationship with vendors. So I'm actually calling, or when they call us, making sure that we communicate. Yes, we have financial constraints, but we make an obligation or do even if it's just a small amount, we do payments just to start the dialogue over again. We're actually revamping our contract administration areas, looking at some of those contracts that we had, if it is really in the best interest of us as an organization. The transparency, accountability, and of course in forums like this, not moving beyond just the rhetoric and talk, the fact of, we need to have action, and that's part of my role, being here.
If we fix WAPA, is that a big assist to healthcare and the facilities?
I wouldn't negate the fact that we need WAPA to be functional for us, but the thing is,
we're in an energy crisis, a protracted energy crisis, though. So I'm talking about, we address the crisis. We're a remote location. We got to generate our own here. Ain't got no pipe and no grid and all that stuff. So we address that works to your favor.
That works in our favor.
Okay,
but
good.
at the same time, we need to have a healthy community, healthy people.
I
Productive
left that
peoples.
out because I want you to come back. I don't know when, but I want you to come back because
I'll see you
if I
tomorrow.
if I can remember, one of the things that you and Senator Frederick back then as your deputy at the Commissioner of Health was we could help our hospitals by eating healthier and things of that nature. That's what I used to brag about that. And he had he had no stomach and that kind of thing showing up, right? So I want to get into that because food security is a big issue that we got to address here in the Virgin Islands. What I was dealing with now, and I've been talking about that this week. You know, and one of my mentors and one of my bosses were talking. He said he doesn't believe we're talking about it enough. So that's something I want. So can I get a return engagement at some point, Madam Pio? You gonna set that up for me? Okay, good. Time fly. Thank you very much for joining us, man. Good to see you. Congratulations, young lady. Proud of you and proud of you too. You know what I'm saying? So enjoy the weekend. Welcome back to St. Croix. You know what I'm saying? Glad to have you here, and looking forward to talking with you on a regular basis.
Definitely.
You got it. Thank you. That's Miss Darlene Baptiste, CEO at the Juan Hospital. Enjoy the weekend. Talk to you on Monday. Be good and be safe.